Hello everyone. As you know that we are interacting for a 12-week certificate course in palliative care, and now we are at the end of the course. It is the 11th or 12th week going on. And you know that palliative care, most of the time people feel is the end of the life service, but it is not true. Palliative care is can be initiated as early as you know that the disease is not curable, but it will go up to the end of your life. So end of the life care is a part of palliative care, no problem, no discussion on this issue. But it can be in the early stage also. But you know that most of the patients are elderly, they are severely sick, they are not able to be treated. So in the end of their life, they are put on the artificial health support system like intensive care unit, ventilators, and intubation for the food and all. This is very pathetic. Most of the time, we do it for the patients, but we know that it is not helping the patient in curing the disease. We are just prolonging his life, a pathetic life, not good life. So, what should be the decision? Very important issue. Nobody wants his patient to die as long as he is capable of treating. But you know that you may like to treat your patient, but patient may not like because he is not improving. Money is being wasted on him. Financial burden is coming. A burnout, family members is getting a burnout because they are facing this problem for a long time. They are running from home to intensive care unit, and they are watching their loved one in the bed, but no improvement for a week, for a month. So what is the point in treating the patient? This is a $1,000,000 question and very legal aspect. But now, in many countries, it has been allowed to die, take a decision to die. In India also, there is a Supreme Court decision, dignity to live and dignity to die. Both things comes under IPC Act. So dignity to die means what? You should decide whether you want to die by giving an injection, that is active euthanasia, or by removing the life support system. You will again die. That is the passive euthanasia. So, but that decision who will take? This is the $1,000,000 question. But otherwise, what will happen if you are doing as a doctor, you are not taking consent of the patient and doing all these things? It will be considered as a negligence of the doctor. He will be penalized. And if the patient family is not doing, it is a source of stigma. Everybody in the society will tell, look, he has not taken care of his father, his mother, his beloved one. So both ways. So nobody has courage to take this kind of decision. Nobody has courage. So in that case, we have to understand what is the land of law and why it is important and whether it should be applied to a patient or not. So in this today talk, I'm going to discuss about all this. Introduction to euthanasia. Definition. Ending life to relieve suffering, usually terminally ill patients. Ending life to relieve suffering from the terminally ill patients. This can be two types. Active, direct intervention. Lethal injections are given and patient dies. Passive, withhold the life-sustaining treatment. Suppose the man is ventilator, remove him from ventilator, he will die within a day or two. Consent, voluntary, patient consent is most important. If he is conscious, he has to give the decision whether to do euthanasia or not. A non-voluntary decision by the family, by the doctors, when patient cannot decide. There is a very stringent rule in the non-voluntary decision, and the board has been created, is constituted by the hospital to take the decision with the consent of family members. But very stringent rules are there. Unless until you know the rules, you should not encourage for euthanasia. So legal aspect I am talking about. In India, the passive euthanasia is permitted. Active euthanasia is not permitted. Passive euthanasia is permitted under specific legal conditions. The Supreme Court 2018 judgment is there, which says if every conditions set by the government under this judgment is fulfilled, then passive euthanasia can be allowed. US physician-assisted suicide is legal. You know, in one doctor in the US, he was giving potassium chloride injection to this kind of patients, and he was penalized, he was jailed, because he was not taking consent. But he was so disturbed by seeing the suffering of his patient, so that he gave the potassium chloride injection. The patient died. That's the active euthanasia without the consent of the patient and family. They should be, and he was penalized. So that kind of situation should never come. In USA, it is allowed, provided the proper consent has been attained. Washington, Oregon, California, Colorado, Montana, these are the states, these are the cities where this is allowed. The goal, legal. It is legal, it may be legal in the Netherlands, Belgium, Luxembourg, Colombia, and Canada. So many people go to these countries just for dying, because it is legalized here. In India, it is not legalized. So you cannot do it here. But if you want to get rid of your life, you can go to this country, get registered. Assisted suicide, legal in Switzerland, Germany, and Japan. Advance Directive and Living Will. This is the important legal document which has to be prepared in advance when patient is conscious. Legally recognized in many countries. Must be signed and witnessed. Laws vary by state and country. In India also this is allowed. The social aspect of euthanasia, this is important. Why people don't go for euthanasia? Moral and religious views. Many religions oppose euthanasia, sanctity of life, because they say you are the custodian of your body. You are not the owner of your body. It is the God who has given the Atma and Paramatma. This Atma is a part of the Paramatma, and He has given you the birth. So He will decide when to die and when not to die. And He is putting you living to bear the suffering so that you can get rid of sins and bad karmas which you have done in this life or in the previous life. This is the Indian philosophy. This is Mrityu Loka. You have come in Mrityu Loka to suffer. Every day you are suffering. Why you are suffering? Because if you have done some bad part in your earlier life or in this life, so God punishes you by giving you the suffering. If you have done the good part, you are happy, hale and hearty. If you are a sick person, you are suffering from problem, it means that something wrong has been done by you. You means your Atma. Atma is coming. It is not dying. It is coming from generation to generation. And Atma is suffering in the form of your body. So this is a very complicated philosophical link between God and person. That's why the social and moral issue is very important. Viewed as unethical and or equivalent to murder. This is the social and religious view. Family society. Many face emotional conflict or stigma. What people will say if I accept for euthanasia of my patient. Influenced by cultural values and societal attitudes. Public opinion. Growing support for death with dignity in some societies, but it is very, very limited. Survey shows mixed attitude across regions. This is the social aspect. Legal framework. Passive euthanasia is legalized. Landmark. Common Cause versus Union of India. Supreme Court 2018 decision verdict. Recognize the right to die with dignity. This is I told you, right to die with dignity is your right. This is your right. As a fundamental right under Article 21. Right to live and right to die. Both are found. The passive euthanasia, withdrawing life support, is legal under strict guidelines. Government has put a guideline. You have to follow that, and then you can withdraw this. Advance Directive, living will are allowed to express end of the life. If the patient has make an advance will, living will, that it become easy to take decision. The key judgment I am just giving you 2018 and 11. Aruna Ramchandran versus Union of India. Passive euthanasia was conditionally permitted. Initiated legal debate. Court suggested legislative backing for this. 2018, Supreme Court legalized passive euthanasia for terminally ill patients. Introduced advanced directive living will, guidelines issued for how to draft a living will, role of medical board, and procedure for withdrawing the life support. So everything has been put in a frame of guideline by the Supreme Court decision, and now in India we are following that part to do passive euthanasia. So advanced directive rules under 2018 judgment, the court laid down who can write a living will, any adult or with sound mind. Suppose I am there, I am today good, I can write my will. In the end of my life, these things should be done. And this will should be registered with the court, so that the blame will come to me, not to my family members. The execution in writing, signed before witness and judicial magistrate first class, they will have to approve it. Medical board, the primary and secondary board of doctors must approve withdrawal of life support. If the will is there, even then the medical board has to decide whether the support should be withdrawn or not. Relevant laws indirectly related. Although there is no specific Euthanasia Act, the following laws impact euthanasia. Indian Penal Code, IPC 1860, Section 302, attempt to murder or murder, punishment of murder, sexual abatement of suicide. Active euthanasia may fall under these conditions, sections, if carried out illegally. Constitution of India, Article 21, right to live, interpreted as the right to live with dignity. Common cause case interpreted this to include the right to die also. Article 21 takes care of both right to live and right to die. And Medical Council of India, MCI, guideline. Earlier MCI code of ethics prohibited doctors from assisting in euthanasia. New policy are evolving post 2018 after the judgment verdict to align with the passive euthanasia rulings. So when euthanasia is recommended, medical condition, terminal illness, when a patient has an incurable disease and stage cancer and is expected to die soon, within a month or two. Unbearable suffering, when the pain or distress cannot be relieved by palliative care. Palliative care in the last is the morphine. Given by using the morphine or by the emotional management, the patient is not getting relief from the pain, then this is unbearable pain. So now it is a case of euthanasia. Persistent vegetative state, when the patient has no cognitive function and no hope of recovery, the patient's vegetative state, then euthanasia is recommended. Severe irreversible coma, patient is coma for a long time, and he is on ventilator, nothing is changing, no brain activity with confirmed medical diagnosis over time, euthanasia can be recommended. Mental and emotional criteria. The patient is mentally competent and can take informed decisions. Patient has repeatedly expressed a voluntary and well-considered request for euthanasia, and there is no external pressure on the correction. These are the conditions when patient can write a will, and these are the medical conditions when euthanasia is recommended. So, medical conditions, terminal illness, unbearable suffering, persistent disease, same thing. Legal and procedural requirement, approval for multiple medical professionals, psychiatric evaluation, especially in psychiatric cases, written consent on advance directive or living will, and review by medical ethics committee or court authority. When not recommended, in treatable medical conditions, when mental illness alone causes suffering but the person is otherwise physically healthy, unless explicitly allowed by law, like in Netherlands. In case of external pressure, impulsive desire, and temporary emotional distress. It is not recommended. It is recommended only in these conditions. Okay? So, summary table. Passive euthanasia, active euthanasia, living will, legislation, and medical activity. 5 things are important. So legal, Supreme Court judgment. Active euthanasia is not possible in India if you consider under attempt to murder or murder. And living will is allowed. And legislation, no specific act is present at present moment, government by case law. Under revision, post Supreme Court ruling. Medical Ethics Board is under revision. So key takeaway, moral religious views, family and society, and public opinion. Many religions oppose euthanasia, I told you, viewed as an unethical experience. Many face emotional and conflict or stigma, social stigma, influenced by cultural values and societal attitude, and public growing support for death with dignity in some societies. And the survey shows mixed attitude across it. Thank you very much for your patient listening.